Good morning, committee. In our new room, can you all hear me back there? Great. New for today. We will be working 4 bills today. We have 16 people who will be speaking in order for us to get through that, and also to allow for questions. We ask that you please keep your testimony within 2 minutes. We will have to time you. If any of you would like to, especially those who have no opponents, if you wouldn't mind saying, hey, I don't mind at all being written only. We have your written testimony. That would give more time for questions. You're combining those two. They're both cosmetology. Yeah.
You just made a comment, you said 4. That's why I was asking.
Oh, I said working. I should have said hearing.
Okay.
I apologize.
That's right.
Okay. Maybe there she is. Committee, we're going to begin with working bills that we ended with on Thursday. And if you will begin with looking at Bill HB 2125. You may recall that is the charitable event with Body Art giving temporary license for folks who come in for a charitable event. And what is your pleasure on that bill? Well, yes.
Thank you, Madam Chair. I move that we pass out House Bill 2125 favorably for passage.
Okay. Second. Senator Baumgardner. Discussion. I do have an amendment. And if you would look at the contents of 2408. And 2408, if you recall, committee, is also dealing with the cosmetology board. And that is the one about the adult care homes that already regulate their cosmetologist and barber schools by the state. And so we passed that out. So when it comes to the amendment of putting in the contents of 2408 into 2125, I move my amendment. Do we have a second? Senator O'Shea. All in favor say aye. Aye. Opposed? The bill has been approved by the committee and passed out.
Well, you just did an amendment.
Oh, I just did the amendment. In too much of a hurry this morning. The amendment has been approved. We're back on the bill. Yes.
Thank you, Madam Chair. I move that we pass out House Bill 2125 as amended favorably.
And second, Senator Baumgardner? I have not. Okay, all in favor of the bill as amended 2125 as amendment, Beverly. As amended, please say aye.
Aye.
Opposed? Okay.
Oh, no, I didn't say that.
Oh, I know. Oh, I know. We were finishing with 2390.
Yes, Madam Chair, I move to reconsider the amendment that you proposed. I just wanted to have time to read that amendment. I have done so. I'm fine with that, and just move to reconsider.
All right. We have a move to reconsider. All in favor? Oh, seconded, sorry. All in favor?
Aye.
Opposed?
No.
So we have moved to reconsider the amendment, and so now we need to vote on the amendment, correct? Substitute, yes. So do I hear a motion for substitute House Bill number 2390? Okay, Senator Baumgardner. And we have a second from Senator Stephan. All in favor? Oh, can we make it a quick discussion? Okay, Senator Petty.
I think we should have a review of what the amendment is.
Thank you, Madam Chair. The proposed substitute for House Bill 2390 would grant power to the Secretary of KDHE to receive access to the drug overdose medical records, as well as law enforcement investigative records, and the decedent's controlled substances prescribing records, and then would require the Secretary to study that information and would mirror some of the language that was found in Section 3 about duties and recommendations following the information that the Secretary compiles and receives from these records. And the last, I don't know, page and a third or so is just the confidentiality provisions to make sure that the data obtained, as well as the personal information extracted from that data, would be kept confidential.
So committee, we are giving the department an opportunity, Department of Health and Welfare, to review, study overdose deaths in the state and get information from other departments. And it's basically mirroring what they do with the maternal death. Yes, Senator O'Shea.
Thank you, Madam Chair. Clarification around, hadn't we created a substitute amendment that was that with the fentanyl strips in it?
It is not. It's just substitute to everything that was in
But, I
2390.
mean, last time we were working it.
And that was voted down.
Okay,
Yes.
thank you.
Yes.
Sorry, I just
Senator
need a little
O'Shea.
bit of clarification too, as far as what we were doing the last time.
Okay,
So
Senator.
with this amendment, we're putting in that language, and then what happens with the fentanyl test strip information?
Thank you, Madam Chair. This is a proposed substitute, so it would strip the contents of the entire bill and replace it with these 3 pages.
Okay. And so the whole issue of the fentanyl test strips, I think it was mentioned last week, is being heard in another committee, but I received verification this weekend that it's not. So we lose that language
And
completely.
you heard that verification from whom?
From the chair?
They will be working that in the conference committee.
Okay, so not the bill or the actual language?
Well, not our bill.
Okay.
Yes, no, yes, but fentanyl strips that came over from the House. Any other questions? Yes, Senator O'Shea.
Thank you, Madam Chair. I know our committee already voted it down, but I just want to say we can't ever assume that something's going to get worked in another place or at a different time, because I don't serve on those committees and I'm not in there. And so I think it's too bad that we're not able to tackle that issue. Thank you.
Point of order.
Yes,
I apologize. Would you refresh me where we're at on this bill? Are we working the amendment or
we are working the amendment. We had a motion and a second, and we were finishing discussion.
My
And now ready to vote. No apologies necessary. And we're ready to discuss. Yes.
So, Madam Chair, we're gutting totally everything. So this there was a different recommendation in this bill for a review board. There was fentanyl, there was the allowing of fentanyl strips to be used within this bill that passed out of the House overwhelmingly. So we're gutting this bill totally. We're establishing a new with this substitute amendment that was introduced on Thursday, a totally different board that really is just looking at asking the secretary, which the other board was much broader, involved a lot of other people that have expertise in the field. This is just asking asking the secretary to study overdose deaths. We already have we already have something like this in place, I believe.
When I asked the secretary, if you recall, at the time when we had this hearing, why is it they couldn't just go ahead and do this now? And she said they didn't have the authority to speak to the other departments, get information from law enforcement, et cetera. This gives them that authorization, just like they have with maternal death.
But it doesn't involve any others. It's just reaching out to those. It doesn't actually establish a board. It's just asking the secretary to reach out to those other entities to provide back then a report
Correct, Senator, and I'm sorry, we're going to have to go on and vote. We have a lot of bills to hear today.
I
and we're
understand
gonna
that,
move
but this
on.
is an important issue, and just because, you've scheduled for hearings today and wanting to work a bill that there are multiple questions about, doesn't mean that the committee members shouldn't be allowed to ask those questions.
I understand. I believe those questions were asked on Thursday.
I don't
but
believe
we'll
so.
move ahead. All in favor of this amendment, please say aye. Aye. And do I hear a motion to pass out? Opposed?
No?
Do you want to be recorded?
Yes.
All right. And now we will move on to, oh, yes, Senator Stefan.
My apologies again. So we're back on the bill.
We are back on the bill.
Some of the conversations sparked my thinking on this, but I would like to make an amendment onto the current bill. And what I would like to do is conceptual. I'd like to take the verbiage that is in SB 6. I don't want to do anything with SB 6.
This is out of order. Madam Chair, this is out of order.
We just voted on this amendment, and let me ask Jenna. I think that's more than a conceptual amendment to be able to add another bill into this, into 2390, this substitute 2390. Okay. We can certainly vote on that. So your motion is to put the contents of SB 6 into this.
The floor. We have a motion and a second. You've moved it. We should be voting on that.
Okay, we did vote on, the second was the amendment, and we did vote on that. We are back on the bill, and when we are back on the bill, we could have a motion on the bill as a substitute bill, or we could entertain another motion. Yes,
And I am making a motion, I'm offering an amendment, which would
Okay.
be to just use the verbiage. I don't want to do anything to SB 6. I want to just use that verbiage to an amendment.
add the
that
contents.
Add the contents, the same verbiage into what's now, what are we calling the substitute, Senate substitute for HB 2390.
Yes,
Madam Chair, we have nothing in writing. We have nothing to look at. I think this is very out of order. If the senator wishes to work a different bill, that's understandable. We have a bill on the floor that we have something in writing that we have actually discussed again and have now voted to amend this 2390. We have made a substitute bill to 2390, and now you're going to accept something conceptual. I object. We need to have something in writing.
okay, Jenna, as you just said, this is up to the chair, correct? Right, and the only thing we have in writing is or we already have Senate Bill 6, and we can vote if we want to add that, the contents of that into 2390, and we will do that now. So we have a motion to add the contents of Senate Bill 6 into this. We have a second from Senator Thompson. All in favor say aye.
Aye.
Opposed?
No.
Okay, the chair cannot tell. So all in favor, yes.
And I just want to make sure I can get some leeway from the committee in terms of combining
Right.
these two bills to make sure that they work correctly.
Right.
Together, the title, et cetera, will need to be amended.
Okay, so you're going to look at that conceptually, okay? Okay. Yes, Senator Petty.
Thank you, Madam Chair. So now what we're considering is the substitute bill of 2390, and now you're asking, or there was a vote that you're going to check, that inserting into the substitute bill, 2390, Senate Bill 6, which we have not looked at since
Well, we worked
week
that
one.
bill, and the bill passed the Senate. So I will say again, the chair was uncertain as to whether that passed. So could I see the hands of those who voted yes? And those opposed? Seeing three, so the bill passes. The
I'd
amendment
like to be
passes.
recorded, please.
Okay, Senator O'Shea would like to be recorded.
Also.
Yes, I think we have that down. So now, in the substitute of House Bill number 2390, where we have inserted the contents of Senate Bill 6. All in favor of that bill, please? Yes. Need a motion?
I move we pass out Senate substitute for House Bill 2390 as amended favorably for passage.
Right, second? Senator Erickson, all in favor, say aye. Aye. Opposed?
No.
It passes. We are ready for the hearing.
I'd like my no vote to be recorded,
Okay.
as well as a comment. This is very disappointing.
All right, committee and those in the conference room, thank you for your patience while we were working those bills. Thank you for being here. We're going to begin with Senate Bill 287, and Jenna, can you give us an overview?
Thank you, Madam Chair. Good morning, committee members. Senate Bill 287 expands the Kansas Silver Alert Plan to include vulnerable persons. The current law in KSA 75-754 requires a Silver Alert notice to go out if there's a missing elderly person. This bill would add vulnerable person, which is defined as a person 18 years or older who has dementia, a developmental disability, or a cognitive impairment as eligible for the public notice under the Silver Alert Action Plan. I'll be happy to answer questions.
Committee, any questions for Jenna? Yes, Senator Petty.
So Jenna, this Senate Bill 287, it just amends the part, or just adds in the part of alerting if someone 18 and older who has dementia and a developmental disability or a cognitive impairment, then that and such as autism spectrum disorder or cognitive impairment. So this is just for alerting, not for any other type of benefits. Would that be correct?
Yes, the process of the alert would be the same, talking to law enforcement, going at the public notice, just the individuals who that alert would be allowed to go out for would be expanded.
Thank you.
And we'll start with the first proponent, Sarah Hart-Ware. Are you with us today, Sarah?
I am. I'm joining you via WebEx this morning. Madam Chair and members of the committee, thank you for the opportunity to submit testimony regarding Senate Bill 287. As you heard, this is a bill to add new communities like Kansans with intellectual and developmental disabilities, including autism, cognitive impairments, dementia, to the Kansas Silver Alert Plan. My name is Sarah Hart-Weir. I'm the Executive Director of the Kansas Council on Developmental Disabilities. Our mission of the council is to empower individuals with IDD and their families to lead systems change, build capacity, and advocate for inclusive, integrated, accessible communities where everyone belongs and thrives. We serve Kansans with IDD through advocacy, public policy, and education. As part of our 5-year state plan for Kansas, our council seeks opportunities to enhance our state's public service and support systems to better serve and protect individuals with IDD, whether that's through measures that provide safeguards and those that prevent abuse, neglect, and exploitation. We believe the passage of this bill, with a minor amendment to the terminology used in the proposed statute, is certainly a step our Kansas legislature can take to protect our most vulnerable Kansans and those we serve with IDD. As you know, 287 amends the Silver Plan Alert to include populations of individuals that we at the council serve, those individuals that are adults who are 18 and up. We know that there is a higher prevalence of wandering in the IDD population, both in children and adults. Wandering happens when an individual leaves a safe area, a family member, or even a caregiver, or a responsible caregiver for that matter, putting one's safety at risk. Some adults and children with disabilities, such as those with autism or an intellectual disability, can sometimes experience challenges related to safety issues and require assistance when communicating with others. According to the CDC, 1 in 44 children have autism, and more than half, or about 60%, were reported to wander over a 5-year period.
Sarah, I don't know if you can hear me. Did you hear at the beginning we had to give a 2-minute deadline? So each person was given a 2-minute limit. I'm afraid your 2 minutes is up. I appreciate so much what you do, and I serve on the committee for IDD. Thank you. Next, we have Sam Sylvie. Sam, are you with us on WebEx?
Hello. Thank you for having me. Dear Chairwoman Beverly Gossage and other members of the committee, thank you for the opportunity to submit written testimony regarding SB 287, a bill to add developmental disabilities, including autism spectrum disorder, to the Kansas Silver Alert Plan. I'm just going to go ahead and go to a personal circumstance my family had just 3 weeks ago. I'm president of the Autism Society of the Heartland and also a parent of a special boy named Brooks, who is on the autism spectrum. Less than 3 weeks ago, my own son Brooks, who is on the autism spectrum, wandered out of our house without our knowledge. We have guardian locks on all of our external doors, but one did not get latched after his older brother came in. While I was in the restroom, he let himself out of the house and climbed into an unlocked car trunk. He pulled it down enough to make it appear closed, so in a panic, we did not notice it was ajar and split up running the neighborhood in opposite directions. After 3 to 5 minutes that felt like an eternity, we realized he was happily watching his iPad in the trunk. Tears of relief and joy for us, and just a huge smile on our nonverbal son's face. We are lucky, but not all are so lucky. When there are systems in place to help with this unfortunate situation occurs, it can be literal life-saving. Our son is 10, so still young for this specific bill's request, but neurotypical 10-year-olds would likely not wander like our Brooksy. So do I think it could continue until he's 12, 18, 25, and beyond? I do. That is why it is critical that individuals with autism be included in this emergency response system. We look forward to working with Kansas to make this necessary change. Thank you for considering this testimony.
Thank you so much, Sam. And now we have neutral testimony, and then committee will have quick questions. So the neutral testimony is Nick Wood, and he's here in person.
Hello, Madam Chair, members of the committee. Thank you for taking this bill up. You can see from my testimony, there's lots of good reasons why you should pass it. The other conferees mentioned a technical amendment that we would like to see made. And I hope that you have it in front of you. I do have copies with me if you'd like them.
If you could provide those after committee, that would be great. Thank you.
Sure. So our amendment just strikes vulnerable person and then adds a definition or a missing person who is 18 years of age, has dementia, developmental disability or autism spectrum disorder. And it's in my testimony kind of the reason why. Just looking at other states, it's clear that when they extended their silver alerts, or did something similar. They tried to avoid that language for some complicated reasons. There's also some reasons that self-advocates have given for kind of why you might not want to be labeled a vulnerable person. So we think their amendment does the same thing, and it makes the bill stronger. So with that, I'll stand for any questions.
Nick, thank you so much.
Thank you.
Do we have any questions for the proponents committee? Seeing none, thank you so much. And we're going to move on to our next bill. Yeah, that closes the hearing on 287. We will move, yes, ma'am.
I had submitted testimony in opposition to that last Friday.
And you are?
Stephanie Sanford.
I have that as written only. Danola, could you?
I've been there in person.
I know, but I think I sent you a reply that we wouldn't have time.
Well, that seems a little bit unfair when everyone has spoken in favor of this. And I believe I'm the only person who's affected
Stephanie,
by that bill.
you may come forward.
Thank you. My name is Stephanie Sanford. You have it written right now. I'm a lifelong Kansan with cognitive impairments. As the bill is written, I am subject to silver alerts. I am 64 years old. The only one who should come looking for me is my mother, and she's dead. The way their bill is written, it makes a blanket assumption about everyone with a cognitive ability or cognitive impairment, and a blanket assumption about everyone with an intellectual and developmental disability. Not everyone with IDD, not everyone with a cognitive development, not everyone with autism wanders. If this bill is allowed to pass as it is, anyone who falls into those categories will be subject to that silver alert. Beyond having disrespect for me as an individual and as a citizen, there is a clear danger with this. And let me just put it this way. Women with disabilities are 8 times more likely to be abused in their lifetime. And I want that to sit really clear. 8 times. If this is allowed to pass as it stands in an abusive relationship, and it has truly happened in my experience as an independent living counselor for Prairie Independent Living Center in Hutchinson. If this is allowed to pass, a woman will be able to escape her abuser, and that has to be done in silence. It has to be done in secret, because lethality of that situation rises as she leaves that situation. If she is allowed to leave and we help her escape, the husband, who is the abuser, and they are very good at manipulation, he will be allowed to initiate a silver alert, and the state will work in concert with that man to bring his abuser back to him to safety. When that door closes, we don't know what happens. I urge you to think twice on this.
Stephanie, thank you so much for your testimony. We will not be working this bill today. We're only hearing the bill today. We will do some investigation before we work the bill. Thank you for your testimony. This does close the hearing on Senate Bill 287, and we will now move to 2340. And we'll begin with proponent testimony. And again, if you feel others have said what you needed to say, or you would be willing to be written only, please let us know that, since we're under time constraints. We'll begin with David Fry. Oh, no, sorry, David. We'll start with Jenna's quick overview.
Thank you, Madam Chair. House Bill 2340 passes the House on a vote of 118 to 3, and as amended, it would modify several requirements for professions licensed under the Behavioral Sciences Regulatory Board, which I'll call the BSRB, add new temporary licensure categories, and establish requirements for an expedited application process. Instead of going section by section, because it is a large bill, I'll go topically, as many of the provisions for one licensure category are repeated for several others, and I will mention those as I go. So one of the things that the bill does is it changes language around reciprocity of licensure, and this would apply to professional counselors, social workers, marriage and family therapists, addiction counselors, and psychologists. The current requirement is that an individual practicing in another jurisdiction would be required to practice 48 out of the last 54 months in that jurisdiction in that profession, and the bill would reduce it to the previous 12 months in another jurisdiction. This would also create temporary licensure, which would be a new category of licensure for social work programs that are in candidate status for accreditation, to create an alternative path for programs that are in that candidacy status but have not yet been granted accreditation. And you may remember last year in conference committee, a bill was added to allow the Fort Hays State University social work program. This would be an extension of that to other similarly situated programs. The bill would also amend continuing education requirements, providing a mechanism to request a time extension to complete continuing education upon a showing of extenuating circumstances. And this would apply to professional counselors, social workers, marriage and family therapists, addiction counselors, and psychologists. And there were House amendments to this bill. One of the things that was stricken was the requirement of continuing education adding an additional 3 hours of diversity, equity, and inclusion. That was stricken by the House committee, that requirement. This bill would also add temporary licensure for professional counselors, social workers, marriage and family therapists, addiction counselors, and this would require complete having their education completed, but individuals waiting to take that examination for licensure, and it would extend that licensure period from 1 year to 2 years. And the bill would also really make changes to reinstatement of licenses. It would decrease the reinstatement fee for inactive persons and allow a 6-month temporary reinstatement license for those who are just not current on continuing education. This would apply to professional counselors, social workers, marriage and family therapists, addiction counselors, and psychologists. And this bill would also allow for a student license for addiction counselors, and there are a number of requirements to qualify for that, including an education plan, as well as some other requirements, which I could go into detail if you need me to. And this would also amend the membership of the Behavioral Sciences Regulatory Board, creating an option between a master's level psychologist or a licensed clinical psychologist, as well as an option between a master's level or a licensed clinical addiction counselor. And this would amend the psychologist regulating statutes, changing language, quote, of good moral character to merit the public trust to be more consistent with other professions regulated by the BSRB, and also modify behavioral analyst disciplinary provisions to be more consistent with the other licensed professions. And one of the main amendments by the House committees was creating an expedited licensure process, and it would create a timeline for the BSRB to process applications for that expedited licensure process. And I know I'm skipping over things in the bill, but I'm trying to be brief, so if you have questions, I'll be happy to try and answer them for you.
Committee, this would be why this bill was brought to my committee as well as Representative Landwehr's committee. I'm grateful that they spent a long time working out all the kinks on this before they sent it over to us. Do you have any questions for Jenna? Seeing none, thank you, Jenna. We will now move to the proponent testimony, and we'll start with David Fry.
Thank you, Madam Chair, members of the committee. My name is David Fye. I'm the Executive Director of the Behavioral Sciences Regulatory Board, and appreciate the opportunity to provide proponent testimony on House Bill 2340. This is a bill that was brought to the legislature by the BSRB and the board. And one thing I would like the committee to know, so the board is made up of 12 individuals, but to assist the work of the board, there are 55 other individuals that sit on standing advisory committees for the board. So what you have in front of you, this large 65-page bill, is the work of a lot of individuals who have done a lot of work behind the scenes, really fleshing out all the ideas. I thought Jenna did an excellent job explaining some of those concepts and the topics that are in the bill. They do address workforce type items in terms of helping people become licensed through reciprocity. That was the significant change the board recommended that's included, from dropping that from 4 years of practice in those jurisdictions down to 1 year. Additionally, there's language in there to help individuals stay licensed if they need more time to do their continuing education hours, and also for individuals to come back to the workforce through reciprocity. There's also establishment of several new types of temporary licenses, so I encourage your support of those items in the bill. As was mentioned, the House did make several amendments to the bill. Some of those are concerning, and I request some amendments from the committee. One was creation of a community-based license. The board has concerns about this license because, based on the language, it appears to function like a temporary license, but it would be for individuals that are at community mental health centers. However, the language allows them to use the initials and titles of individuals who are permanently licensed, and these are individuals who are not permanently licensed. So from a title protection standpoint and protecting the public, we would ask that that language be removed. Additionally, the language removes certain social work requirements for clinical social workers in terms of their education and experience, and we ask that you make that change as well. It's included in my testimony. As well, there's some different procedural items for the BSRB that are included that would speed up the time frame of licensing and also do expedited licensure. As it stands, the bill would cost about $300,000 and make us add about 4.5 new individuals to implement those. But I think if there are some changes that can be made to that process, we could lower that amount down to about $100,000 per year and just add 2 new staff members. So happy to go into more details on that, but I know time is limited. So.
And David, you said that you would make sure we get those amendments before we work this bill, correct?
Yes, and 2 of those amendments are in the packet of testimony. And then I've been in contact with other constituents concerning the amendments to the 3rd piece, and I can bring that to you before you work the bill.
Thank you. And next we have Cynthia Schindel. Cynthia, do you intend to testify? You're on WebEx. Are you with us?
Good morning. Yes, I'd like to testify briefly.
Okay.
Good morning. Good morning, Madam Chair and members of the committee, and thank you for this opportunity to speak as a proponent of this bill. As David described, it is a bill that the BSRB has created. I am currently a member of the BSRB, but I'm speaking today as an individual LSCSW who has practiced in Kansas for over 30 years. During those years, I've seen an evolution in the licensing requirements for the LSCSW credential. Initially, the definition of clinical social work was not as specific as it is now, but because the only legal privilege that it brings is the privilege of independent diagnosis and treatment of mental disorders, that eventually became the definition. And so the experience that is required for the LSCSW credential is solely, well, there's 3,000 hours of postgraduate supervised experience, 1,500 of which must be direct client diagnosis and treatment of mental disorders. The amendment that was put on this bill in the House would allow any other kind of social work experience to be count towards the LSCSW. And I'm urging the committee to strike that amendment because it would make the LSCSW a less qualifying credential than all the other mental health professions. They all require, excuse me, the same number of hours, and they have to have the same kind of only experience diagnosing and treating mental disorders. There are many kinds of social work. It's one of the things I love about the profession, but someone who has done 1,500 hours or 1,400 hours or however much of that
Cynthia,
total.
I'm so sorry. I know you can't hear the timer, but the 2 minutes is up. Thank you so much for your testimony today.
Thank you.
Next we will hear, next we will hear from Representative Susan Ruiz.
Thank you very much, Madam Chair. And I am here again to speak to HB 2340 as a clinical social worker myself. I have been in practice in Kansas, started my clinical practice in Kansas in 1993, and I've seen many changes that have happened. One of the, and you have my testimony, I'm not going to read you my testimony. There are two things that are important within this bill. One is that being able to make some changes and adding some flexibility in the requirements will help us when we start looking at the social work compact, which we hope will start becoming a reality for us next year or the year after. And so this will help us to be more in line with the states that are surrounding us. The second thing was adding the diagnostic impressions, and you'll see that more, I think it's on page 15 of the bill itself, and adding diagnostic impressions. More and more social workers in Kansas and in other states are much more in integrated medical professions. Even if you're working at a community mental health center, you aren't necessarily arriving at a diagnosis. You may be collaborating on one, but being able to make a diagnostic impressions because there is someone else, a medical professional such as a psychiatrist, nurse practitioner that is making that diagnosis. If you're working in the hospital, is the same way. And so being able to add those diagnostic impressions will continue to allow social workers that are working towards their LSCSW to be able to work who are working in many other areas and who are not trying to become independent, having their own therapy practice. And the vast majority are not independent therapists. So that would allow for that. Thank you.
Thank you, Representative. And next we have Becky Fast. Becky, we wanted to come forward.
Hi, I'm Becky Fast. I'm the Executive Director of Kansas Social Workers. Social work is the largest provider of mental health. We are at crisis levels for clinically trained social workers. KHI reports only 67 in Western Kansas. The House, under Chair Landwehr's leadership, put some amendments to address this crisis. One change was to this 15-hour course oversight regulation. So now BSRB has its regulators who are not social workers, they overrule accredited coursework. If a social worker has their syllabuses and all their papers, they can prove it, but most are seasoned social workers who can't prove it. This mandate has meant so many social workers going to our neighboring states who welcome our social workers in hopes of coming back through reciprocity. You should not have to move to practice in Kansas. Sadly, the majority never come back. I saw this as a clinical social worker for years in Missouri. Their agencies were largely staffed by our social workers due to this regulation. So the national accreditation standard, national standards to be a clinical social worker, same in every state. Master's degree, 4 years of supervised practice. You have to pass 2 national exams, all for the average salary of $55,000. So in Kansas has some of the top quality social work programs from small Christian colleges. I went to Bethel and Newton, to our state universities. Our high test scores prove it. What is more troubling, it's only 30% of our master's graduates are becoming licensed because of all our regulation, all the paperwork, BSRB, and we have 300 less bachelor social workers now than we did in 2020. So we ask that you pass this bill as amended by the House. It reduces merit barriers, increases efficiency, protects the public through increasing access to care. Thank you.
Oh, perfect timing. Kyle Kessler, are you with us? And okay, Kyle.
Good morning, Madam Chair, members of the committee. I am Kyle Kessler, Executive Director at the Association of Community Mental Health Centers. We appreciate the opportunity to appear here this morning in support of House Bill 2340. We support the underlying bill that was brought to you by the BSRB, and we believe the House did good work as well. At the appropriate time, we would support amending the bill to add federally qualified health centers, substance use disorder programs, and psychiatric treatment facilities for youth to the bill as well under the community-based license section. And we do see this as a workforce bill for behavioral health, especially on the clinical side. So as you have questions, I would stand for those at the appropriate time. Thank you, Madam Chair.
And next we have Mitchell. Are you with us on WebEx? And do you have something to add to testimony that's already been given?
Yes, I do. I'm here.
Okay, please continue.
Okay, thank you, Chair and members of the committee, for the opportunity to testify to this bill via this televideo format. I am in support of the bill as amended by the House committee. I am currently a licensed master social worker under training supervision to become clinically licensed. I operate a private practice here in Topeka, specializing in therapy for older adults and geriatrics. And something important to know is that only clinically licensed social workers can be reimbursed through the Medicare system. So for someone who specializes in geriatrics, that clinical licensure is essential to lines of revenue and payment for services. And I support that the House committee amended not to adopt a board-approved supervisor mandate, as I think this further limits opportunities for social workers to become clinically licensed. And I also support the amendment to reduce the 15-hour education requirement and only require the 3 hours of psychopathology course. The courses that are required in the bill that were kind of scratched by the House committee are ones that are pretty uniform to accredited social work programs. And so anyone who graduates from an accredited program, which is already a requirement for licensure, would have met those requirements. And I spent apparently 45 days when I submitted my training plan, trying to go back and forth with the board about whether or not my classes from an out-of-state university would meet all of those tedious requirements, despite the fact that my program was nationally accredited and highly ranked. And so it did take an extended amount of time for me to be approved for clinical license supervision. And I don't believe that social workers who are farther out from their degree program, I was only 6 months from my program when I applied, would be able to access their syllabi. If you can think about your graduate school or bachelor's programs, if you've been to them, do you still have syllabi from those programs? Probably not.
Thank you so much for your testimony. And finally, we have Monica Kurz of the proponent category. Welcome, Monica.
Yes, thank you, Madam Chair and committee members. My name is Monica Kurz. I am Vice President for Policy and Prevention at the Kansas Suicide Prevention HQ. We are one of 4 988 Crisis Lifeline providers in the state of Kansas. And I'm here at the committee to speak as an employer. You've heard from the association that we really see this as a workforce bill that has some real implications for helping us to build a critical workforce in the state. I'm here to support the bill as amended, and particularly draw attention to the committee, or of the committee, to the diagnostic impressions piece of the clinical licensure. At this point, I can tell you that our in-house training and experience on the Crisis Lifeline is providing invaluable and very different experience for social workers in their training to be able to serve in the crisis mental health workforce. And we lose folks who want to go pursue their clinical licensure because that experience at this point doesn't allow diagnosis, but it certainly allows for diagnostic impressions, as well as good safety planning, suicide screening, and other, I would say, essential skills for social workers. So we highly encourage the committee to continue that amendment, and happy to stand for questions at the appropriate time.
Thank you, Monica. And then we have neutral testimony from Eric Thomason.
There is one more. I have one more too. I submitted for in-person support. Jennifer McCabe. Jennifer McCabe.
Well, we are running out of time, so.
Okay.
I can be brief.
Okay, Jennifer, is there something that you feel that you could add? Okay.
Thank you. I'll be brief. My name is Jennifer McCabe. I'm a licensed clinical social worker in the state of Kansas. I'm coming to you in support of House Bill 2340 as amended in the House. I practiced social work in the state for the past 15 years. The current process places unnecessary burden on the applicant while not providing additional safeguards to ensure professional competence. The process is especially burdensome for applicants who move to Kansas from another state. I received my master's degree in social work from San Diego State and began my social work career in California. When I moved here, I began the process to become licensed in this state. It took the board 7 months to determine how many hours of supervision from California would be accepted towards Kansas licensure. Most of the delays were due to the boards not responding to multiple attempts to communicate or losing paperwork from my supervisors. Even though I graduated from an accredited university with a clinical focus 8 years prior, I was required to submit syllabi for my graduate courses to show my coursework covered advanced clinical interventions. This happens to social workers who also attend school in Kansas. Because I did not keep all my syllabi, this required me contacting my supervisors from previous university to request copies of my syllabi. The Council on Social Work Education, CSWE, is our national accrediting body that determines if coursework meets clinical standards. If a school has CSWE accreditation, the state boards should accept this as meeting the professional standard. I fully support reducing the additional specific hours of coursework requirement from 15 hours to 3. We need competent clinical social workers in this state. We entered the profession to be of service to the community and protect vulnerable populations. The current Kansas statutes discourage social workers from pursuing licensure, leading to less qualified professionals meeting the demands of consumers at a time when mental health care is in high demand. Thank you.
Thank you. And now we move to neutral testimony, Eric Thomason.
Chair Gossage and member of the committee. My name is Eric Thomason. I serve as Vice President of Behavioral Health and Addiction Treatment Services for Community Health Center Southeast Kansas. Very briefly, who we are: we employ over 900 employees. We have we completed 72,315 unique patient appointments last year. So those are how many folks come to see us in Southeast Kansas. Total visits 273,156. So we serve quite a bit of folks in our Southeast regions. I support a lot of what was said by Director Fye, so I will skip half of my testimony in sake of time and talk about House Bill 2340. As it's currently written, it creates a temporary licensure for community-based providers. This designation would allow non-licensed staff to identify themselves as fully licensed clinicians. So an example of this would be a community-based professional counselor introducing themselves as a licensed professional counselor. Another concern is with 2340, they shifted from a 12-month temporary licensure to 24 months. When you combine these two things together, this potentially creates a situation in which a non-licensed behavioral health clinician can identify themselves as a licensed behavioral health clinician for up to 24 months. There's no regulations regarding how many times they can take the examination. The statute specifically states it does not limit the amount of times that the applicant can take the exam. So I respectfully request that if this bill should carry, that it be required to provide attestation that they are a temporary licensed community-based provider. We do this with a variety of other disciplines. And then to also amend temporary licensure duration and community-based licensure duration back to the original 12 months. 24 months is quite a bit of time to be out of school and pass certification exams. And I will stand for questions at the appropriate time.
Thank you. And Stuart Little, do you have something to add?
I do. Thank you, Madam Chair. Stuart Little, Behavioral Health Association of Kansas. These are standalone substance use disorder treatment providers around the state. The original bill, the amendment that was brought in the House that had the community-based license did not include us in this, and as a workforce issue, we appreciate the amendment that Mr. Kessler offered that will get us into the bill. So that's all I would have to say. Happy to stand for questions at the appropriate time.
Committee, this is the appropriate time. Are there any questions of the proponents or neutral? Senator Petty.
Sorry. So I guess I'll go back to Kyle Kessler. You mentioned, Stuart Little reinforced that. So say it again, who you want included within the bill that's not currently.
So we would add, currently it covers CMHCs under the temporary community, the community-based license, I apologize. And this would add FQHCs, private treatment facilities, which would be the substance use disorder programs, and psychiatric residential treatment facilities for youth.
And the justification for that is?
Adding additional opportunities for other provider safety nets.
Thank you.
Thank you, Matt.
Senator Holscher.
Thank you, Madam. Excuse me. Thank you, Madam Chair. I think Becky might be the best person to answer this question. I'm curious about what Cynthia brought up in regard to the amendments that were added and concerns for reducing quality. Can you elaborate on that?
Yeah, I was there in 2003 when it was added. So in 2003, BSRB brought on psychologists, master level, marriage, family, and therapists, and professional counselors. They allow related fields to be licensed. And at that time, they brought on all these grandfathered in, all these professionals. Social work had been practicing for 30 years. BSRB at that time said, well, it'll be easier if we do social work too for administrative processing. We don't allow related fields. I think the Senate committee heard how social work accreditation standards take far longer than other mental health professionals. So it should have never been applied to social work in 2003. And we, Kansas chapter opposed it then. But now with the workforce crisis, I mean, we haven't seen the impact like we're seeing it now, so it is long overdue to be removed.
Senator Petty.
Becky, sorry you walked away. So there was testimony about the community-based licensure and one, reducing it, two, of being unlicensed, but I thought as I looked at it that they had to be under the supervision.
Are you talking about the mental health center? Which one?
The
the community-based mental health. Well, so what we've seen now so much, social workers, after 2 years of supervised practice, it's very hard to work during your master's. And most who come clinically trained have a bachelor and 1 year of supervision. Other licensed professionals don't have a bachelor in social workers. So social workers are pretty broke after they graduate. I'm hearing from Pittsburgh that social workers are going to go work for a casino, Amazon, because they can't wait several months to get licensed. So the community health centers brought that forward so that their students can more quickly get licensed and practice and get reimbursed for services. Is that what you're asking?
I wasn't clear enough. I was talking about the temporary, the new temporary license.
Oh, yeah, BSRB brought that forward from 1 year to 2 years because social workers, it gives them a longer period to pass the exam. We offer exam classes. I offer to help any social worker, but it's a very rigorous national exam. So basically that temporary extension gives social workers longer. I hear from community mental health centers, they lose that social worker because they haven't had time to take the exam.
Thank you.
This closes the hearing on 2340. Looking at the clock, we do have next Senate Bill 297. However, we do have 2 testimonies. We won't have time for questions, so we could do that outside the committee. But Brittany, would you like to testify? And we may not have time for Jean. Okay, please come forward. There are no opponents on this bill.
Hi, thank you guys for having me. I'll be very, very brief because it's a very simple bill. I'm Brittany Jones with Kansas Family Voice. I'm our Director of Policy and Engagement. I'm also an attorney. We have seen across the country in the last couple of years, really in the last couple of months, abortion statutes being misinterpreted by doctors and by abortion advocates. And some of this is probably unintentional, but we think it's very important in order to protect women and ensure that they get the medical care that they desperately need in tragic situations, to ensure that they get that care, to clarify our definition of abortion and clearly lay out what abortion is not. We all know what an elective abortion is in this room, but we want to ensure that everyone throughout the state of Kansas, both doctors and women, and anyone reading our statutes understands what you all mean when you write an abortion regulation. So I ask that you would pass this bill out favorably at the appropriate time. Thank you.
Thank you. Committee, we have time for one question. I see.
Chair, we didn't even have a presentation by Jenna on this bill.
Oh, you're right. We did not. Thank you, Jenna.
Thank you, Madam Chair. Senate Bill 297 would revise the definition of abortion to clarify procedures that are excluded from that definition and standardize the definitions of abortion in Kansas. Sections 1, 2, 4, and 5 state that abortion and medical emergency means the same thing as they are defined in 656701, and Section 3 amends the definition of abortion in 656701, and the words are largely the same, but they're reorganized to add clarity, and it would add that removal of an ectopic pregnancy as well as prescription of contraceptions are not included in the definition of abortion. I'll be happy to answer questions.
Thank you very much. And we'll, committee, if you have questions for either Brittany or Jean, please feel free to contact them, and you have their written testimony. This closes the hearing on 297, and we are adjourned.